How do you know if you have IBS? This is a surprisingly complicated question because it's much more difficult than you'd think to figure out whether or not you have IBS. And we get this question a lot, of course. And IBS is surprisingly common, but the thing is that it's surprisingly variable. And that's why it's so confusing. So let's talk about how variable IBS can be. Hi, I'm Dr. Stephen Wangen, the founder and medical director of the IBS Treatment Center. We see a lot of IBS. In fact, we're the only place I know of that truly specializes only in treating IBS. But how do we know it's IBS? There are so many symptoms of IBS that it gets a bit crazy. So listen really closely here. There might be pain, but there might not be pain. And when there is pain, it can be anywhere in the abdominal area, anywhere, right, left, up, down, top, bottom, you name it. And it can be occasional or it can be constant. It can be once a day or it can be once a month or even less. And the pain can be mild or it can be dull and achy or it can be really severe or it can be sharp and stabbing, and it can even be so bad that it puts you in the hospital. You can have diarrhea, or you cannot have diarrhea. Most people think that IBS is always about diarrhea. It's not. It can be either way. And it might not be diarrhea even if you have a problem. It could be loose stools that you don't think of as diarrhea. Or you can have constipation or not have constipation. Or you can have incomplete bowel movements that maybe you don't usually call constipation, but you never seem to feel completely evacuated. Or you might have rabbit pellets, or you might have stools that are like mud, or some people describe them like peanut butter or something. Or you could have alternating diarrhea and constipation. Or you could have neither diarrhea nor constipation, but have normal bowel movements and just have abdominal pain. Or you could have no abdominal pain and just diarrhea. Or you could have no abdominal pain and just constipation. You could have lots of super stinky gas or no gas at all. And you could have tremendous bloating, for example. A lot of people describe that with their IBS. Or you could have no bloating. And you could have mucus in your stool, or you could have no mucus in your stool. And some people even just pass mucus sometimes and nothing else, and they'll describe it that way. And sometimes with IBS, you even get a little bit of blood in your stool. And those are just the most common symptoms. There are many, many more. So for example, you might have weight loss, or you might have weight gain, or your weight might be normal. You might be hungry all the time, or you might feel full all the time and never be hungry. Or your appetite might be perfectly normal. You might have nausea or heartburn or reflux or hemorrhoids or all kinds of other things that I can't even remember because there's so many problems that IBS can cause, even non-digestive issues. And I'm sure that you're going to ask me about them or share your stories about them, and I encourage you to do that. So please do. IBS is variable, and it's probably nothing like most people think it usually is. Now, what do all cases of IBS have in common? Well, here's what it is. You go to the gastroenterologist, and they do some testing and a colonoscopy and basically find nothing other than maybe a polyp or maybe some inflammation. Neither of those is going to help you out much as far as IBS is concerned, right? Or you end up with a diagnosis like microscopic colitis or collagenous colitis or lymphocytic colitis or maybe eosinophilic esophagitis, all of which I consider subsets of IBS because they are symptoms, not causes, and they respond just as well to our treatment program as people do with just plain old IBS. So then what did your regular doctor and the gastroenterologist do? Well, they mostly ruled out a lot of other things like cancers and gynecological issues and IBD, which is ulcerative colitis, and Crohn's disease. And that's super valuable and it's great. But it doesn't help you get better if you don't have those problems. And unfortunately, they are not experts in IBS. And that's how you know that you have IBS. It's mostly a process of elimination of other issues. There is no test for IBS, and there never will be, by the way, because it's a symptom or a whole bunch of different kinds of symptoms. It's not something that you can test for. It's something that you tell the doctor about that you have. But that's not going to stop companies from trying to sell IBS tests, right? It's just ignore them. They're useless. Now, once you know that you have IBS, there is good news because now you know what to do next. You need to work with an IBS specialist, which is the specialty I created in 2005 because there wasn't one. That's how you solve IBS. It's not impossible, it's just that you haven't worked with the right kind of specialist yet. And although we're rare, it's not as hard to find one as you might think because we routinely work with patients all over the US and the world via telehealth, and we've been doing that since 2005. Now, if you found this video helpful, please give us a thumbs up, and to learn more about IBS, be sure to subscribe to my channel. So now do you think that you have IBS?